So you're someone who suffers from piles and you want to know how to stop bleeding piles. I mean, what are the causes of piles? The common causes of piles include having a poor diet, which means you're not taking enough fruit and vegetable. You're also not drinking enough water. And this is what's responsible for strengthening and fortifying the walls of your bowel. There are other factors like lifting heavy, especially in builders, construction workers, people who go to the gym and you're doing heavy squats. Also straining if you're constipated, for example, and if you're pregnant and you're also constipated while pregnant. These are all factors that will contribute to your risk of having piles. And some of the common symptoms to expect would be pain on passing stools, especially if you're straining and your stools are hard. You can also feel pain on sitting, so it's uncomfortable to sit down. And in more severe cases, you might get bleeding, where you might have small amounts of blood like a teaspoon, or you might actually notice splashes of blood when you go to the toilet. In really extreme cases, you tend to get non-stop bleeding, which might go on for at least a good half an hour, and which happens frequently throughout the weeks or months. Also, you have to remember that most people talk about feeling piles on the outside, which sometimes can feel like the size of a grape if they're quite inflamed. But you can also have internal piles, which is piles on the inside. And when I refer to piles on the inside, I'm simply talking about the wall of your rectum. So in these cases, you would need an examination by your doctor. So your doctor would usually use a finger to feel the piles on the outside, but they would also have to go into your anal passage to feel if there's any piles on the inside, or any blood inside your anal passage will indicate that you do have internal piles as well. And if the finger cannot get there, in some cases they'll use a special equipment called a proctoscope to go in to look for any piles on the inside. In terms of treatment, the basic treatment is usually creams and suppositories. So for bleeding piles, because it's quite inflamed, it's sore, it's painful, you are going to need a steroid-based treatment to reduce the inflammation and to help stop the bleeding as well. So usually over the counter, you might get Anusol, which is the cream, and the suppository. Now the suppository is a small kind of tablet that pushes, into the rectal wall, while the cream is used more on the outside. But if you have bleeding piles, you'll find that Anusol doesn't work. So you're going to need Anusol combined with a steroid. So usually it's called Anusol HC cream or Anusol HC suppositories. These are treatments that you use morning, in the evening, and after every time you open your bowel. It is advised not to use it for more than 7 days because it contains a steroid, and a steroid can cause thinning and easy fragility of the blood vessels, which actually leads to more bleeding. In addition to creams and suppositories, you would benefit from cold compress or actually putting ice in the area. This not only helps to soothe the piles, but it also helps to constrict the blood vessels, which allows for the bleeding to be reduced, and in some cases the bleeding actually stops. You will need to do this a few times during the day and also throughout the week. In addition to this, you need to change your lifestyle. So you need to eat more fiber, eat more fruits, drink more water, get rid of your poor diet such as your burgers, your fries. These are all foods that contribute to piles as well. You need to avoid straining. So it's quite important that with your change of diet, your stools start to begin to get soft. So avoid straining as much as you possibly can. Take laxatives if needed. And also, for those who are lifters, like bodybuilders or construction workers, during this period, you need to avoid lifting as much as possible because you're putting excess pressure on the lower abdominal area, which is what causes your piles to reappear in the first place. If despite all these treatments, your symptoms are ongoing, the piles are still big, inflamed, you're still having bleeding, then you would need to see a doctor, because this usually means that you need further treatments, whether it's laser, whether it's rubber band ligation, surgery. They are all different methods for getting rid of piles, and your doctor would usually decide which is the best treatment for you to have. Now, I hope you enjoyed this video. Please feel free to share, like, and comment. Thank you very much.